This is the Change Physician, episode 188.
So this is if I'm thinking like, okay, I'm a practice owner, or I'm a new physician who's interested in private practice, which is sort of kind of rare these days, but you're looking at this world and you're like, I'm this little fish.
Yep.
And there's all these big fish that are gobbling. You have the big health systems, and then you have private equity, and I'd love to get into that a little bit more, but they're gobbling stuff up. And you're looking at your options, and as a little fish, you don't have any clout. What it sounds like then, what HPA is with this membership model, is almost like a co-op where you're moving into it. And what this does is, it sounds you're membership oriented, so the docs are maintaining control versus private equity when they're going to own, whoever sold the practice may make some money, but everybody else is going to suffer from it.
Correct.
And then be able to compete now in this changing environment as a bigger fish, but more like, I guess you're like a big school of fish as compared to a great white shark or something.
Correct. That's a great way to look at it. Sometimes I'll say we're a supercharged GPO in essence, right? Because we have literally group purchasing as a big feature of our business model. So that's a great way to put it.
Yeah. I've listened to some interviews in the past, and so it reminded me to ask you just like some of the services within there's like different ways that you can come in depending on what people need. Do you mind like addressing kind of like the basic categories of things? You mentioned some of them, but like even growth initiatives and how that works.
Yeah, we kind of like to articulate it as the continuum of relationships with HPA. And so on the low end, I guess even before membership, there's retail consulting or retail DataDx. So we want as many providers on DataDx as possible, because that will bring real-time benchmarking across the industry. That doesn't really exist today. We just launched dental benchmarking in real time as an example. So we've got our retail components. Our consultants can do a strategic planning engagement. You don't have to be a member of HPA as an example. The next level is the membership model, and we have 4 or 5 different membership level options. We created that because there's different sizes of practices, and it needs to be right sized for the practice. We have equity memberships and non-equity. The equity memberships simply issue options, stock options to our members. HPA's goal is to become a publicly traded company. And in doing so, that helps also with diversification of the practice assets. And that's why we're issuing those warrants. The non-equity membership is a lower price point, but also because we're not yet public, there's certain criteria that you have to meet to issue options unless you're an employee of the company. And so that allows us to have members and still, in catch most doctors, but not maybe that don't meet that criteria for the equity piece. Over on the fullest involvement, that's where we're talking about our MSO DSO, where we're going about that on a joint venture status. So there's some entities that would need to be structured to support it and to be compliant within corporate practice of medicine and all the different state regulations. But that's the fullest spectrum of involvement would be on a regional and specialty basis to form a joint venture where the administrative assets and also needs of the practice are served.
And even I remember when I first learned about you all, even, and that seems like a general categories, but even from from a detail standpoint, like helping negotiate credentialing, contracting, and you have all these other even merchant service providers, like those kind of things are kind of part of the details of the multiple menu items, so to speak.
Yeah, those are all embedded in the different levels of membership. And so we want to make sure the practices, at the lowest level of membership, the practices have access to the store, the GPO, as I stated it earlier. The next membership level, there's a couple hours of consulting and they get a financial assessment. Every practice that comes on board, however, gets a practice assessment. And so that's our way of saying what's going on in your practice and where can we help? We don't want to make any assumptions. Sometimes they have a business manager, sometimes they don't, or a practice administrator. The titles go all over the place depending on the practice, but there's different levels of consulting. So credentialing is also sometimes embedded into that membership level. Credentialing is something that practices struggle with, and they shouldn't. And we've built that into DataDx as a module. So we're storing the documents there, and we've automated. There's a lot of different credentialing softwares that exist. And so we just built our own. Pardon?
Sorry. No, I was just wondering if you could go into DataDx. I know
sure.
that was your first baby.
Yeah. Yeah. That started with running the practices and spending hours every month trying to build reports. So you're running, and it is applicable to any type of business. There's usually multiple systems that you're using to run a business. So in healthcare in particular, just simply said, there's a general ledger system where you're writing checks. Sometimes you're paying your people, and there's a production system. Now we have EMRs, and that's sometimes a third system. Sometimes those are combined. So DataDx combines all the sources of data, just layers on top. There's no software change required. Build an API, pull the data and funnel it into DataDx for that particular practice, aggregate the data, put an anomaly detection system inside. So that's watching for trends, pattern changes, sometimes good trends, sometimes not so good, right? Maybe there's a cash flow issue that DataDx will see and alert the practice of before the practice might know. Sometimes, it could help with a situation regarding fraud. Other times, hey, you're doing great, crushed it. You've been seeing 10% more in XYZ procedure, as an example. So it's a real-time data analytics tool, essentially. So a SaaS platform that we've built, and it's system agnostic, which is great. We can pull data from payroll systems, pull data from CRM platforms as well, quality data, and we're working with rural health systems and built out some quality reports so that they can help drive improvements within their system too. So it's really diverse in that regard. But the best thing about it is it's real time. All of our members have a license of DataDx, which is why we were able to launch the real-time dental benchmarking. It's a big milestone for the company. We're really excited to launch it on the physician side as well, but we have a large group of physicians, but not one single specialty represented. So we're waiting to have a deeper number of docs in one particular specialty on the medical side, but we should be able to do that over the next 6 to 12 months.
So just to clarify, then you're layering over top all the business systems, and this is both financial as well as kind of practice specific value-based care kind of metrics. So you can actually pull out and aggregate that data.
Yep.
And then I'm assuming then as your organization grows, you'll be able to approach insurers and basically say, this is what our docs are doing, and these are value-based metrics, and
yes,
reimbursement should change appropriately given this other group either can't make those numbers or their numbers are worse than ours.
That's right. Absolutely.
Awesome. Super
Thank
cool.
you. It is really cool. I didn't build the code myself, but that came up with the idea, and we've had a great team inside of DataDx. And the cool thing about it is the consultants are kind of the brain, right? You've got all this data, and that's what sets us apart from like a Tableau. There's two things with that. Tableau isn't automated, right? You have to upload and refresh reports. I mean, you can pay for a more expansive license, but also there's no what's next. What do you do with this? And so we've built in some algorithms that with some, there's machine learning inside the tool as well. Absolutely. But the consultants can also help drive and get those anomaly detections like, oh, check these 3 things. This is probably what's going on inside of the practice, and call the doc or the business manager. So there's a lot you can do with it. It goes beyond just simply the data.
Now, I know there was some primary care initiative or something I'd heard you speak of as far as primary care physicians utilizing or trying to get them more involved. I wasn't sure what I had heard, but can you speak to like how many people in primary care are using it, or how you see this? I don't know. You said the specialties are kind of in multiple locations. So it just seems like primary care could really use a lot of help in this. And there's not a lot of independent primary care physicians, not as many as I wish they had.
Yeah, they're still out there, but there's definitely not as many as there used to be. From a primary care perspective, what we've tried to do with HPA is build in a top line revenue strategy that pays for their membership essentially, and then get DataDx involved as well for their practice so that they can breathe a little easier. I mean, primary care is seeing a lot of patients, and they have to make margin and, pay for the staff that they have, the support staff to handle the volume. So that's what we've tried to do for that. We need primary care in our ecosystem. It's really important. It's important because, just even taking an orthopedic example and how patients go back and forth between, do they meet the criteria for surgery, and who's really managing that issue, and they need to work together. And so we need primary care at the heart of our business infrastructure. But typical with medicine, we're going after docs that right now can afford it, and then trying to build in a component that will help the primary care docs afford it as well. And so there's a few strategies that we've used for that. A couple are platforms essentially that are helping with chronic care management, behavioral health, billing and coding, because it's really complex and daunting on the staff to get all of that documentation and do it in a compliant manner with Medicare, as an example. And the others are other ancillary type services that they could be doing that they don't know they can, or they're referring out. So their revenue leakage essentially is occurring within those practices. And sometimes it's literally a factor of time. And so whatever we can do to help them monetize those opportunities in a compliant and ethical way, but yet scalable, is going to be the right approach for primary care.
Nice.
So that sounds like at this point in time, that would be the minority of involvement. Like, I mean, you basically, specialists, this makes more sense for right now from the revenue model and things. And I'm sitting here and I'm thinking about primary care. If my suspicion is those who are involved are either in those group practice, they're primary care clinics that have multiple docs that were previously maybe doing okay and now have been struggling in somewhat trying to maintain their independence. Are you saying group practice, or are they solo practice? Because I'm wondering, if I was a solo primary care doc, I'd probably go more of a direct primary care model.
Yeah. Yep.
And then I'd want something that kind of layers onto that. So
I'm with you. I think that's the way to go as well. Some docs are really scared to go direct primary care or that concierge model. They're not sure what to do. They don't know how to do it. And we've helped some groups with that in the past. And I do think that's a really good approach. There's not a lot of single primary care docs left. I mean, it's just, you can't handle the overhead load, and it doesn't really make sense. But they are out there. So both exist.
Yeah. Well, I love what you're doing for just trying to, even on your website, stated the perfect words: empower physicians to be independent and to support them. And I love what you're doing.